Welcome to the Family Capacity Building Workshop supporting your child with FASD. My name is Randy White. I am the cultural clinician here at Firefly in Kenora, Ontario, and I'll be your host for today. We very much appreciate you being here and hope that you're all staying safe and healthy at home. We have over 67 attendees from across the region joining today, and we're all really excited to have you here. Before we start, I just wanted to do a land acknowledgement. We are hosting from the original lands and territories of the Anishinaabe, the Muskoka, and the Métis peoples, Treaties 3, 5, and 9, as well as the Robinson Superior and the Robinson Huron treaties. We strive to honor our responsibilities to care for this land and uphold the treaties that were signed therein. This event was hosted by the Coordinated Service Planning Provincial Network. The network comprises a consortium of 28 coordinated service planning lead agencies from across 38 regions in Ontario. As sponsors for the workshops, with funding from the Ministry of Children, Community and Social Services, the network comes with extensive knowledge of FASD in terms of research, the provision of clinical and family support services, and the delivery of the FASD worker program. Some general housekeeping for today. This presentation will be about 2.5 hours long with no intermission. At 2 different points in this workshop, you'll be asked to join a virtual breakout session to participate in an activity and discussion. You will be given instructions on how to do this during these times. Throughout the workshop, the presenters will provide an opportunity to ask questions. If you have a question, we ask that you type it in the chat box. When you submit the question, please let us know which presenter the question is geared to. We may not have time to get to every question, so if that's the case, you can send it to an email address that we will share in the chat near the end of the presentation. This event is being recorded. Please turn off your camera if you do not wish to be seen in the recording. Please mute your microphone while the presentation is in progress. Use the chat for questions and comments and for any technical difficulties. We're here to help. Please reach out if you have any questions during the event. We have other presenters joining me today. Eric Marais. Did I say that right, Eric?
Marie, close enough.
Sorry.
Okay.
He's an FASD coordinator at Surrey Place in Toronto. Cereena Rows. Karina.
It's all good.
2 mistakes now. Sorry. Who's an FASD consultant with the Children's Community Network in Sudbury. Oh, there's another one. Liane Guenette. Did I say it right?
Well done, Randy.
All right. Who's an FASD worker at Cochrane Temiskaming Children's Treatment Center. And Kim Stewart, who was a New Beginnings FASD coordinator with Dunjum. You're probably going to have to help me with this one.
No Dwin Tag, Place for Healing.
Hey, okay. Very good, thank you. And helping us during our breakout activities and monitoring our Q&A chat is Chrysta Wood, who is an FASD worker with Firefly, supporting children and families across Kenora and the Rainy River districts. So again, I welcome you all. Chimigwich for joining us, and I'll hand over the spotlight to our first presenter. Miigwech.
So what we hope that you walk away with today are three different things, three different learning objectives. And the first is learning how to best identify how your child's strengths can accommodate them during challenges. The second is learning how best to assess when advocacy is required for your child. So when we're advocating for our child, we're sort of speaking up for them. We're speaking to other adults in their lives around just kinds of supports that our child needs in order to better engage with the world around them. And then participation. So learning how to best detect when to involve your child in solving challenges. Throughout the day, you'll see a lot of these different points referred back to, right? So a lot of times you might see today after a strategy or an accommodation that we recommend the green S. So what we're doing there is we're referring back to the learning objective of learning how to best identify your child's strengths and how they can accommodate them during challenge. And then you might see the yellow A or the blue P. So what we're really doing in those slides is we're just calling back to these three big learning objectives. There's a lot of information in this presentation, and some of the language can be clinical. We tried not to include as much clinical language. We wanted to use everyday language that everybody understands, but sometimes that language just tends to slip onto the slides without us noticing. So if you have any questions about any of the terminology, please ask, please let us know. So one thing we want to say from the top, and it's probably the most important idea that we want to bring across to you today, and that is to always stay connected with your child. You know, this past year, we got to spend a lot of time with our children during COVID. Some of our kids are still doing online schooling, and some of us are working from home. And so we are spending a lot of time together. It's important to enjoy and to remark when times are good. So be, as much as possible, be in the moment with your child, especially during those good times. Label them as good times. Your child may not know that, you're noticing when times are peaceful, that you're noticing when they're actually not struggling, when they're not having a challenge, and you guys are having some great moments together that you're connecting. So start to label those for them, right? So that they start to recognize it for themselves. What's a good moment? When is it that, that we're not always trying to solve a challenge, but we're actually enjoying ourselves, that we're engaging in something meaningful together. These moments that you spend with your child are the times that you're building that foundation of trust, that foundation of support between you and your child. So as much as possible during the day, take some short breaks with them to engage in some enjoyable activity. It doesn't have to be a whole hour or even a half hour. It could just be little moments during the day that you go in and you check in with them. Another thing too that we're encouraging is for parents to start being detectives, working together with your child to figure out where some of the causes might be for the challenges that they might be facing, the problems that they might be having. So we're going to use that word a lot today, detectives, right? Being detectives together, try and figure out where this stuff is coming from, and then what kind of support, what kind of help we can provide for our child. So your relationship with your child is much more important than getting the math homework done. It's really a foundation on which to build problem solving. So as much as possible, we encourage parents to problem solve together with their child. There's an author called Dr. Ross Greene. I'm sure a lot of you know him. He wrote a book called The Explosive Child, The Explosive Child is a great book. I really encourage you to read it. But he says in that book, he says that challenging behavior occurs when the expectations being placed on a child or youth exceeds that child or youth's capacity to respond adaptively. So what he's saying there is sometimes, probably most times, our kids or our teens misbehave, putting that in quotation marks, or act out when they're not able to meet the expectation within that situation. They may not have the skill to meet what we're asking of them or what's being asked of them in that situation. They may also not be able to cope in that situation, right? They may not be able to manage their own thoughts and emotions in certain stressful situations. And so they may not be able to communicate that to us in a meaningful way because they are young. And so that could look, the way they're communicating it can look like a bad behavior to us, right? It could look like they're acting out. So what Dr. Ross Green is saying is that kids, youth in those circumstances are lacking the skills to handle that circumstance, right? There's something in that particular situation, there's an expectation they're being placed on them that they cannot meet. They don't have the skill to meet it, so they need our help. Dr. Ross Green says the goal is really to help kids, help their parents, their caregivers solve those problems, solve what he calls lagging skills, rather than trying to control or change or modify our kids' behavior in that moment by promising them a reward or by threatening them with a punishment, right? In the old days, our parents, you know, if we did something great, our parents may have given us praise, or they may have, maybe they gave us something, right, to reward us. Or when we did something that wasn't something that they wanted us to do, they may have threatened to take something away, or they took something away after. Well, for someone who's not able in the first place to meet that expectation, meet that behavior that you want them to do because they don't have the skill in that moment, promising a reward, threatening a consequence, has no effect. They really need our support. So Dr. Ross Green says, instead of focusing on the reward or the punishment, focus more on helping them in that situation, during the situation, and also after the situation, coming up with a plan with your child, with your team on where they would need the support. Also involving other caregivers, right? Other parents in those discussions as well. So ask your child if they need help, and if would they have any ideas about what kind of help that they might need. So become detectives together to problem solve, right? Hear that blue piece popping up because we're calling back to that learning objective, learning how best to involve our kids in some problem solving. We often speak up when our kids are doing something wrong to correct them. So our heart is in the right place when we do that. But our kids do many things well and no one tells them. No one labels those things for them, that they're good things, right? No one tells them that. So another idea that we want to bring across to you today, the second most important idea today, is to start putting more of your energy and focus on their strengths. Placing all our attention all the time on what our child or our teen does wrong limits their potential and it negates their strengths. It's an attempt to correct. So our heart is in the right place, but it doesn't tell the child what to do and it builds on nothing. There's no teaching. So we encourage parents to be strengths focused, right? Celebrate your child's successes, label things as successes. It'll make it easier for them to recognize something as a success as well, and it'll build self-confidence. A lot of our kiddos, as they get older, their self-esteem has really taken a beating, you know, over that length of time. And by the time they become teenagers, they might lack a bit of motivation, right? Because they're lacking self-confidence. So focus on your child's strengths when talking to them. They'll need to know what their own strengths are. So we need to start labeling those great things they do as strengths to them. So then they start themselves to recognize, hey, I have strengths and these are my strengths. We had a young lady at Surrey Place and she worked in a very busy shop. And this shop was used by a certain industry in the kind of work they do. And her bosses called her in one day because, she was falling behind. She was coming in to work on late. She wasn't very organized. And so they talked to her and they asked what was going on. And what she was able to do is she was able to tell them what her strengths were, where she thought she could help the store best. She didn't really know where in the store, where in the shop, but she just knew what her strengths were. And her boss worked with her. Once he knew what her strengths were, he was able to place her in that shop in a way that she contributed as best as she could, right? So she had a really, really successful relationship in that job. She's still there today. She's very successful at her work, but they knew what her strengths were and they were able to sort of place her and play to her strengths. She knew what her strengths were, right? So she was able to communicate and advocate for herself. So being strengths focused with our kids, focusing on their strengths when we talk to them, will build self-confidence and they'll likely try new things and be motivated. So take an interest in their interests. I know I've watched a lot of bad television with my own kids, and it was in the interest of taking an interest in their interests, right? It was to start conversations with them around the kinds of things that they like. A lot of times interests do become strengths when we facilitate them, right? When we make it easier for them to build on that strength. So if my kid likes coloring, if they like art, then to facilitate that, to make that happen for them so that they keep making that art, right? So they keep maybe even building on that interest, and then that could become a strength. Tell their teachers, tell their educational assistants, their coaches of their strengths, their interests. Do what that young lady did in that shop, right? Letting them know how best she can interact, how best she can contribute in that environment, how she learns as well, right? So provide those individuals, those teachers, those educational assistants with something like an all about me sheet, where you could, it's sort of a blank sheet. Sorry, it's not a blank sheet, but there's blanks in there that you can fill in what your child's strengths are, what their interests are, how best to interact with your child. The All About Me sheet is found on the internet. It's free. You can Google it, All About Me, and then FASD, or you can go on our resource list and it's available there. The resource list will be made available to you at the end of this workshop through a link. So I'm rushing through a little bit. I apologize. It's just I'm just trying to make up for the time that I wasted today trying to get my internet back up and running. Your child does great things, right? So we need to recognize, we need to complement their strengths. Be a strengths detective. There's that word again, detective. Keep a strengths inventory. And that's really a list of the strengths that your child has, even a list of their interests, because we know interests do become strengths. You can keep that list maybe in a journal. You might have a journal where you keep all the information of different people you've contacted for your child or the services your child's involved in. That would be a good place to put those strengths in there, right? And then keep it updated, changing it as they move to a new stage. Your child can have tons of strengths that we ourselves never saw as strengths, but they are. Maybe they're a captivating public speaker and we think they're just being a showboat or they're showing off. But talking in front of a large group of people and keeping them engaged, that's a strength. It took me years to even, think of standing in front of 10 people and talking, right? But some kids already have that as a strength. We need to compliment them. We need to label that as a strength. Maybe they're a hands-on learner. They learn by watching another person and they do it along with them, and the hands, are sort of learning, the body's learning as well. And so these are kids that are hands-on learners. They learn through experience. That's a strength, right? And we need to play to that strength when we're teaching them. Maybe they won't quit until they're finished something. You might send your daughter out to shovel the driveway and it's dinner time, you call her in, but she won't come in until she's done shoveling that driveway. That's a strength. So keep track of your child's strengths. Knowing their strengths will help you know what to change in your environment to build on these strengths, to build on those interests, right? I always use the word facilitate. Facilitate is just to make it happen for your kids, right? So make that building of that interest happen in your home. And knowing your child's strengths can help you become an effective advocate, especially when sharing information with other adults in your child's life on how to best arrange their own environments to successfully interact with your child. And it also helps with strategies. It can help with strategies. It can help with accommodations, with supports to challenges. Can some of their strengths be used in accommodations to certain challenges? Focusing on their interests takes away from all that interest, all that focus we place on their challenges, right? You might have a kid who's maybe having problems in school, or you might have a teenager who's had trouble with the law even. And so these areas, these problem areas, sort of a growing bubble in a child's life, and they see their life through that growing bubble, right? It becomes their life, all these problems. But there's other areas of their lives that are shrinking, right? Those interests, those things that they like, they may not be focusing on those as much anymore. Their brain, their thoughts may all be around their challenges. So what we want to do when we focus on their strengths, on their interests, is we're interested in growing those bubbles back up, right? So that their life isn't just their problems, even though we're still going to address those, they're still there, but they've got these whole other areas growing that are outside those problems, right? So they're experiencing life through those as well, not just the challenges. And they start to see themselves differently, right? We know they're not the problem. The issue is they're having challenges with some skills, right? The issue is they're having challenges with some learning. But when we focus too much on that growing bubble of challenges, sometimes they might see themselves as the problem, which they're not. But if we grow those other areas of their life, they'll start to see themselves a lot differently, and they'll start to see life differently. They might start to place more of an interest in those positive areas, right? And they might be more interested in taking on that volunteer role, kind of like how I took on that, that volunteer role every Thursday night. But your child may have other areas that they can volunteer in and learn some important life skills in those roles, but also build their own self-confidence by contributing. So if your child likes to do a task like doing groceries with you, but they take up all your time when they do that, do more of those activities with them. I know sometimes it might make the activity, like grocery shopping longer, but if they like to help out in those situations, it can build self-confidence, right? They want to have positive experiences. They too are not enjoying the negative stuff. They're not enjoying the fights, the tantrums. They would rather have more positive experiences, and they would rather have them with you. So involve your child in their strengths, in their interests. If they like to be outside or active, involve them in shoveling, in raking. We may not even like shoveling or raking, but for an 8-year-old, learning to, seeing themselves contributing to something like shoveling the driveway, handling, the big person shovel, that could have a different effect than it would on us for them, right? They might feel like they're contributing. They might feel that they're a positive aspect of this family. So if they like to be helpful, have them do things like take the garbage out. If your teen likes phones, show an interest in their apps. And more, try and do new things together, new activities. It doesn't have to be for a long period of time. It could just be for a few minutes. See if you both like to do it together, right? And it might turn into an interest, or as you're doing it, you might figure out, wow, this is already a strength of my child. And then your child or your teen might sort of take that interest to the next level, right? They might do it more on a more regular basis. Sorry, I rushed through a lot of this. I just want to make up for time, but I'm going to throw it out there. I can answer one question maybe. Is there any questions around strengths? Chrysta, is there any questions out there?
There's nothing in the chat right now, Eric.
Okay, good. You scared me. I thought my internet went out again. Anyway, so I will now hand it over to Cereena, who will talk around how FASD can affect certain areas of the brain.
So as mentioned, my name is Cereena, and I work for Sudbury Children's Community Network, and I'm the fetal alcohol spectrum disorder consultant. So before we begin to talk, I'm going to talk about the brain domains impacted by FASD. But before we begin, we're just going to take a moment to talk about what exactly is FASD, or how is it defined, okay? So CAN FASD, which is one of the leading research teams in Canada, and great advocates, describe FASD as a lifelong disability that affects the brain and body of people who are exposed to alcohol in the womb. Each person with FASD has both strengths and challenges and will need special supports to help them succeed with many different parts of their daily lives. So we will go through some of these challenges in a moment, and later on we get into more detail about the accommodations that or supports that we will put in. Okay, so there are 10 brain domains that are affected by FASD. So these are academic achievement, attention, cognition, language, memory, neural anatomy or neurophysiologically, executive functioning, adaptive behavior, which is the social skills and communication, motor skills, and affect regulation, okay? So, FASD is a spectrum, so not everybody will have challenges in each of these areas. And in order to receive an FASD diagnosis, a significant impairment in 3 or more of these 10 brain domains need to show impairment. Okay, so if you have 2 that are impacted, FASD would be ruled out. 3 or more, an FASD diagnosis would be ruled in. Okay. So we're going to take a few moments to look at each of these brain domains. Okay, so we've got the control part of the brain, which involves executive functioning, affect regulation, and intention. We have thinking, which involves memory, language, and cognition. We have daily life, so that's the academics and the adaptive, again, the behavior, social. And when we have the physical, which is the motor skills and the neural anatomy piece. So that's the changes in the central nervous system, okay? We're going to take a moment to go through each of these and see what type of concerns may take place as a result of the prenatal exposure to alcohol, okay? So in the attention, the individual may feel easily distracted, might not be able to focus on a routine for a long period of time, fidgety, that kind of thing. And then we have affect regulation, and this may have difficulty controlling and addressing their emotions. So, that these might, kiddos that are engaged in temper tantrums, right? That may be harder to control, or perhaps you have like an 8-year-old child that's engaging in a temper tantrum that looks more like a 2-year-old, okay? And then also this includes anxiety, depression, and mood imbalances, stuff like that, okay? So the emotional regulation. And so, controlling and adjusting our emotions. So then there also could be impairments in executive functioning. So that's our higher order thinking, okay? So may have trouble with planning, sequencing, problem solving, maybe impulsive. So go from A to D without really thinking things through, right? Difficulty understanding cause and effects, changes with transition. So these may be the kiddos that really have difficulty from ending one activity and moving on to the next, and could result in a meltdown, right? And when in fact it's these kiddos get stuck as a result of the executive functioning. And difficulty with concepts, abstract thoughts, and consequences, and so they don't. So when they're consequence, they might not learn from the consequence or learn from their past mistake, that kind of thing. So you can imagine what that would look like when when you're using some of those standard behavioral techniques and they're just not working due to issues with all these brain domains. So then we have the thinking part of the brain. So we have the cognition, and we have the memory, and we have the language. Now these areas are involved in the thinking, okay? So with the cognition, you have your thinking and reasoning. So, the problem solving, your ability to, problem solving, maybe this isn't a great idea for these reasons. Understanding complex ideas, so that more of that higher level thinking things through, okay? So there could be problems with that. Problems in memory, so difficulty with long-term memory and short-term memory and working memory. So when I work with families who have children or youth impacted by FASD, memory problems are really one of one of the main concerns. I see it quite often. May appear to lie due to the memory impairment. So I think we get into this a little bit later on, but that's called confabulation, okay? So what is happening there is when a child or youth is asked a question, and because there's that memory problem, the short-term memory or the long-term, their brain is trying to fill in the blanks. And so, the brain's working really hard to try and fill in the blanks. And what it does sometimes is comes up with with a story that is really true to the child, but or the youth, but in fact it's not true. Okay, so it's important to remember confabulation versus lying. Okay. Also trouble with memorizing, so that's difficulty there in school, right? Selecting and organizing information, that kind of thing. So, and then we have language, so delays in language development. So there could be problems with expressive language, there could be problems with receptive language. So often kiddos with FASD, when there's problems with receptive language, so that's understanding what's being told to you, they may come across that they understand, more than what they actually do. So because often kiddos, there's a disconnect between the receptive and the expressive language. So the expressive language could be more well developed, and the receptive language is underdeveloped. So these kiddos come across like they understand more than they do. Okay, so that's really important to understand. And the other thing is, can repeat instructions or rules but not follow through. So what ties into that, is again the short-term memory, the language. Also, I think we discussed the abstract thought. So kiddos with FASD often have problems generalizing. So that's learning one rule in one setting and then applying it in different settings. So learning at home, whatever the rule may be, but then, at school doing, what they're not supposed to do because they can't generalize to apply that rule in a different setting. Okay. And then we have the daily life. So that's the academic achievement and the adaptive behavior. So that's your social skills, things like that. Okay. So there could be problems in school. So the reading, the math, and that's because a lot of the in school, there's the abstract thoughts, right? That higher level thinking comes into play. Okay. And then with the adaptive behavior, social skills, and social communication, the child may not understand personal boundaries and have difficulty reading social cues. So they may come across as a lot younger than what they actually are, okay? Because of that, that's that delay adaptive behavior. So as a result of that, although the child may be 14, they may be functioning developmentally more like a 7-year-old. So therefore, they're vulnerable. They could be taken advantage of by peers. So I see this often too, where I'll be working with the schools, and the school will tell me that Johnny has left the school, and he's doing this all the time, and it could be because he wants to feel accepted by his peers, and he's vulnerable and easily influenced. And so without being able to problem solve the consequences of that, he ends up getting in trouble because he just left the school grounds without permission, right? So that's how that's an example of that can look. Okay. May have trouble with hygiene, money, and coping skills. So, again, those healthy coping skills when they're feeling overwhelmed, that kind of thing. The coping skills developed to help us get through those difficult times are not as developed as they should be. Okay. And then we have the physical areas that could be impacted. So that's the structure and functioning of the central nervous system. So the brain, how the brain was developed. And often FASD impacts kiddos at a cellular level. So if you were to look at a neuron, some of the damage, you can only see it's visible through a microscope. And then other times it's more visible if you were to look at MRIs of a brain that has been prenatally exposed to alcohol. Okay. So brain structure and functioning. And then you have your motor skills. So difficulty with balance, strength, coordination, reflexes. There could be your muscles again could be floppy, that kind of thing. And difficulty with printing in scissors. So those are the in a nutshell the concerns in the 10 brain domains that are assessed that you may see. Okay. Yeah. Any questions in regards to that?
Hi, Karina. We do have a question in the chat from
Okay.
Jane. I'm going to do my best to articulate it. When you were going through the brain domains, he had a question around why a lot of people with FASD may be diagnosed with ADHD.
That's a good question. And please jump in, anybody else on the call, but it's my understanding, because the diagnoses overlap. There's the symptoms of ADHD and FASD, many of the behavioral symptoms like the inability to the impulse control, the inability to focus, maybe possibly easily angered, so that kind of thing. There's a lot of overlap between the two diagnoses. And so, and I'm not sure if it was, the question was why sometimes they're misdiagnosed, but if that is the question, in order to be diagnosed with FASD, a mother needs to admit, or somebody that is close to the mother, has to witness the alcohol consumption during pregnancy. Okay, so often it's without that information, an FASD diagnosis cannot be confirmed. So that's often could lead to the misdiagnosis as well. Any other questions? Okay.
Mari just wrote a question about printing being a common issue. Is this because of physical issues?
That's a good question. It'd be great to have an OT on the line, but I mean, if I was to answer that, in my opinion, I would say yes. Because that's a part of motor skills, right? That the printing. So, in my opinion, I would say yes. Yeah.
Absolutely.
Any other questions?
That's
Okay.
it.
Oh, okay. I'll pass it. Believe it's Eric again.
Yes.
Okay.
Thank you, Karina. Yeah, so many of our healthcare professionals out there know more about ADHD than they do about FASD. So some of our kiddos do get misdiagnosed. Absolutely. So I'll share my screen. Karina, if you could stop sharing your screen, I'll put mine up.
There we go.
Awesome. Okay. Okay. Okay, great. Zoom is so different from Teams in some respects, so it's a learning experience for me. But thank you for your patience today, folks. We do see a lot of our parents actually tell us that fine motor skills, those things you do with your fingers, can be seem to be affected by FASD, and we know that motor skills can be affected by FASD. But we do get a lot of parents telling us that using scissors, maybe buttoning, a shirt, and using a pencil, those are all fine motor skills that are required to accomplish those things. And we do get a lot of parents telling us that this is a concern for them, is those fine motor skills. Also, when we're talking about the 10 brain domains, sometimes we leave out sensory, right? Because that's outside of the 10 brain domains. But we know that outside of those, there can be sensory issues with kids, with adults, with fetal alcohol spectrum disorder. And so when we process, all of us, when we process information, we process them through our senses, right? The big five are sight, hearing, touch, smell, and taste. But we also process information in our environment through balance, through our body's movement, and also what our internal organs feel. And all this information coming at us, right? Noise that we hear, or touch, that we touch through our fingers. All this is information from the outside world coming to us. And we're sometimes able to filter all that info coming at us and focus on what's most important, right? Maybe it could be the person in front of us giving us an important instruction, and we're filtering out all the other stuff that we're seeing, right? Maybe there's a loud poster off the side here, or there's somebody using a jackhammer outside the window. But we're able to sort of tune those out, you know, to the best of our ability and focus on that person talking in front of us, giving us an instruction. Some with FASD may have difficulty with that filtering. And some with FASD may also feel flooded sometimes when they're very sensitive to certain sensory issues, so or certain sensory information coming at them. So someone might be very sensitive to touch, or they might be very sensitive to noise. And when those things happen, they feel flooded, they feel very overwhelmed. And then we call that hyper sensitive, right? So they're overly sensitive, but they might also be undersensitive in other areas, like maybe they, you know, they're able to sort of walk on the cold ground without feeling cold. And you might have a kid running outside, you know, in bare feet and not complain. They're undersensitive, right? They're what we call hyposensitive. So, and they might actively seek more of that sensory input if they're hyposensitive or undersensitive in that area. And so your child with FASD may have difficulty responding effectively to different types of sensory input, or too much sensory input coming at them at once. And they might be good at managing the input one day and then not so good the next. And they might also be unable to appropriately communicate this difficulty, tell us about this difficulty. And this might look like a bad behavior to us, right? So here we have to be, you know, in terms of sensory issues and challenges, we have to be a detective again, right? Kids aren't always, especially our younger kids, they're not always able to express these sensory needs. So we can, you know, if we see that there might be one, we could kind of figure out what, you know, they might be experiencing by what they're doing. And then we can guess what might help as a support when they're feeling very sensitive in those areas, right? It could be a tag maybe on the back of their shirt that's bugging them so much all day long that they can't focus on all the other stuff happening around them, right? And they're not able to effectively tell you, it's the tag that's bugging me, it's scratching me, or the shirt feels too tight on me, and I can't focus on all this other stuff happening. So they might not be able to talk to you in this way. So you would try and figure it out by what they're doing, and then trying different strategies and seeing if it works. Again, if this is a big concern for you, sensory issues and sensory challenges, I would recommend that you do see an occupational therapist. An occupational therapist might be able to help. I know in schools right now, if your child goes to school and they're not doing online learning, but they're actually physically going to school, I know that right now is probably a good time to try and get those kind of appointments through the school, because there's not a lot of kids that are actually in the buildings right now across Ontario. I'm not sure how it is in Northern Ontario right now, but it's right now, those wait lists are a bit shorter, I think, at schools for things like an occupational therapist. And you can also go to your family doctor if this is a concern of yours and you'd like to see an occupational therapist. They might be able to help with sensory concerns, sensory issues. Okay, so we're going to do our breakout activity in a few minutes. I just want to describe it first before we do it. It's actually fairly easy. It's just a group discussion. You're going to be placed in a smaller group. You don't have to do anything on your computer. It all gets done automatically. And so for 10 minutes, you'll be in a smaller group and you'll be having a discussion around a scenario that we're going to present to you in a minute. A scenario about an 8-year-old girl who has FASD. In the discussion, we're going to be detectives and we're going to try and figure out where certain challenges might come from in Amy's life. And so you'll have a chart that'll be on your screen during the small group activity, and you'll be able to see those 10 brain domains that we described, and there's little descriptions beside the 10 brain domains, each of them. And so what we're asking you to do is to start a conversation with everyone and see are there some brain domains that can explain some of the challenges that this child in the scenario we're going to present, some of the challenges that her and her family are experiencing. Often we know that these 10 brain domains do do get oversimplified, right? And they do overlap. So there could be more than one brain domain involved in one challenge. And also, not everything is explained by FASD. There could be other things like sensory, or there could also be just typical life changes, right? Life challenges. It's not all FASD. So you can also discuss those and see if some of those can also help explain the cause for some of the challenges that this little girl, Amy, is going through, her and her family. So before we go into our breakout rooms, let me tell you about Amy. This is the scenario we'll be discussing. So Amy is 8 years old, and when her mom asks her to do something, she says no. When her mom takes her by the hand to make her follow through on an instruction, like brush your teeth, Amy screams and cries and runs to her room and slams the door. At school, she fidgets in her chair and sometimes walks around. Other times, she might doodle while the other students are working. Her drawings can be quite good, and she can tell you big, imaginative stories around these drawings. But her parents are concerned because she also can storytell or make up events when they ask her about her day. After school, Amy wants to use YouTube to watch videos of people making crafts and drawings, and she likes to make it alongside them. She can be quite messy when she makes her crafts, and when her parents say, no, you can't do that today, she screams. Amy loves the outdoors. She loves hiking, camping, and spending time with her family, anything physical. But she'll scream and she'll cry if her parents compliment or interact with her brother. She may even hit her brother. So her parents have become quite exhausted because the frequency and the intensity, so the amount of times that it happens and how it happens, has gotten worse over time.
We talked a lot this morning about some strategies in the brain and strengths. So now we're going to talk about how we can help and providing some different accommodations. So the first brain domain affected that we're going to chat about is language. And so oftentimes when we are thinking about our kiddos with FASD, they have difficulty with complex and abstract or symbolic language. So I think of a time when I was in a meeting with a client of mine, and we were talking about how it was actually supposed to rain. And I said, oh, I hope not, knock on wood. And he just looked at me and he said, Liane, the table is made of plastic. And I laughed and I said, yes. And then I went, yes, you're right. And so I was just trying to kind of talk about how like I was hoping it wasn't going to rain. So sometimes when we use things like sarcasm or metaphors, I can kind of go over some of our kiddos' heads. So it's really important that you use language that isn't abstract or symbolic. So they may not understand what's being asked of them. And so this is where, they don't understand. This is where they might not understand the words. So they might hear them, they might not understand them, but they might only pick up on a few of them here and there. So if you're someone like myself who sometimes tends to put too much words in, I do this with my daughter sometimes, and I have to stop myself and go, no, okay. If they're only picking up perhaps every second or third word, and you're giving too much information, then they're only going to pick up bits and pieces. So it's really important that you give just a few words and you get to the point. And at the same time, it might take them a while to process what is being said and what those words actually mean. So we had talked about how a lot of our kids can have auditory processing difficulties. So you want them you want to give them that chance to process what you're saying and what the words actually mean. And then, but even with that, they may fail to follow through on something they agreed to do. And then you have to remember that sometimes memory falls as part of that. But it also might be that they didn't understand the instructions that were given and they didn't know how to ask for clarification, or they didn't realize they didn't understand the instructions. So oftentimes you have to kind of check in to see and just clarify whether or not the child or youth understood what was asked of them. So and just saying like, did you understand? And them saying, yeah, I got that, isn't enough. So you might need to have them kind of give you an explanation of what you've said to kind of clarify that they've understood. So language kind of continuing is, so one of the things that's really important is to say the child's name and make eye contact with them before you start talking to them or giving them instructions. So especially in a group setting such as a classroom, it can be really hectic and busy. And we talked about how some sensory difficulties sometimes play factors in that. So it's really important that you say to the child's name. So, okay, Johnny, we're going to be doing this next. So it's also important that you're not saying it to them across the room. You're going to want to get close to them, eye level, and say whatever you want to say is your instruction. And this is going to help them kind of focus on you, on what you're saying. But you also have to remember that our kids do have a difficult time filtering. So get to the point, get what you got to say what you mean. So it's so important that you use concrete language. You don't want to leave them guessing. So don't give hints on what you're trying to say. Be very specific, and like leave no guesswork for them. Be very apparent about the language and what your expectations are. So state exactly what you want them to do. So rather than saying something like, don't run in the house, if they're only hearing bits and pieces and they hear run, okay, great, I'm going to run. So rather than, you want to avoid what you don't want, talk about what you do want. So if a child is running and you don't want them to run, you're going to say walk, and then so say what you want. You also want to avoid giving abstract information. So you're going to, it's really important that so if you give an instruction such as, okay, Johnny, we're going to go and clean your room. Go clean your room. That's a very broad and vague instruction, right? So what does that mean? So you might need to break it down a little bit more and say, I want you to go to your room and pick up your blocks. And once they've picked up their blocks, then you might need to give them another instruction and say, now I want you to pick up your books. So it's really important that you give one instruction at a time, but you may need to show them alongside of them. So you might have to say, okay, we're going to pick up your blocks, and you might have to do it kind of hand over hand with them to show that. And that's kind of to build on their strengths, right? Because oftentimes our kiddos are hands-on learners. So that's really important to do. And then it's also important, well, like I had mentioned, they're hands-on learners. And so as you show them, you want to tell them what you're saying so that they can relate the word to the action. So that's really important. And so you might have to help them clean their room for years to come, but you're going to do it calmly, and you're going to kind of repeat it as you're doing it. And then, but be very specific, right? So we're going to pick up the blocks. We're going to put the books on the shelf. We're going to put your laundry in the laundry basket, rather than clean your room. That's too broad. So to continue on, it's also really important that you break everything down into simple steps. So one-step instructions given at a time. So if you're looking to leave the house and you say, okay, I want you to go to the front door, put on your coat, your boots, grab your backpack, we're heading out, that might be too much information. So you might need to give them one instruction at a time. You might need to say, go to the door, put on your jacket. Once they've got their jacket on, you might need to say, put on your boots. And then once they've got that on, you might need to say, put on your mittens. You might need to kind of do that. But visuals have been known to also be helpful. So whether it's you actually physically showing them and you're putting your jacket on as you're doing it and you're modeling the task and the instruction, or visuals, visual cue cards, which we're going to kind of chat about in a couple of slides to come. So visuals help kind of provide information in a visual format, and it helps kind of accompany the language and the verbal skills with the action. So that's really helpful. In the resource list, we are going to be providing you with a website on where you can go and get some, use some visual aids and how you can create some visual aids. So that's going to be on the resource list. But at the same time, it's really important that, again, we're stressing this because it's so important. You have to give the time for the child to process into the information. So our kids oftentimes don't process information as quickly as we do. And so for us, it can be instantaneous, but for them, it can take time to kind of leave from our lips to go to what, from our lips to their ears, to get to their brain, to kind of dissect what's being said, and then to react. So especially when it's new information, that's something that's also really important. So you want to allow them the time to answer, and be patient. It's so important to be patient, especially if it's the first time that you are giving them a new instruction. So now we're going to chat a little bit about memory and this brain domain and some strategies for that. So we already know that it can be difficult for our children to remember information. And so think of your brain almost as a file cabinet. And so when you have, when there's certain tasks that you want to do, you go into this file cabinet, you get that skill set, and then you put it back into that file cabinet. So at times for our kids, being able to retrieve that information isn't as easy. They go to the file cabinet and all of a sudden the task isn't where they last left it. So it can be really difficult for them to retrieve information. And so this is where it's also difficult for them to use information. So just because they've learned something, it doesn't mean they're going to be able to generalize it and be able to put it into action, right? So this is why it's so important that as you're teaching them things, you want to teach them in the moment. So you're not going to necessarily look at necessarily teaching something where you're going to put aside 15 minutes a day to work on a specific task. You want to try as much as possible to incorporate it in your everyday life and to teach it kind of in that moment and have it be spontaneous. And then, but you also have to remember that their learning can be inconsistent. So this is often where our kids may have inconsistent school practices. So we may have a child who goes to school and the teacher, and I've heard it with my own daughter, where they'll say, you know, she does really, really well one day, and then the next day she's coming and it's like she's never seen the material before and she doesn't know. And so, you know, I kind of call it like a good brain day versus an off brain day. And so sometimes she's going to that file cabinet and that skill set just isn't there that day. And so it's really important that we take that into consideration. So things that can be helpful are some reminders, such as some visuals. So here are some ideas on some visuals. So this would be an example for a morning, for kind of the morning transition, to get up and get ready for school, and then what they need to do, right? So for getting dressed. And so it can be really helpful. So you'll see the little blue P there, and that's part of participation. So ask the child or youth, you know, where could we place this visual, where it could be helpful for you, where would it be most practical? And so if they say, you know, it would be really helpful to have this in my bedroom next to my dresser, well then fantastic, you know, then that's a good place to put it. So you want to be generous with your reminders for our kiddos, and you want the reminders to be positive, and you want to use a supportive tone. So oftentimes, even with some of my clients, what I've done is, even with parents, rather than saying like, don't forget you have A, B, C, D to do today, sometimes I've encouraged parents to say like, you know, kind of say like, oh yes, I just remembered you have that dentist appointment today. So it's not that you're kind of saying, don't forget, it's almost like the parent is saying to themselves, they're kind of giving that friendly reminder, but they're using themselves as the example. And then the child's not going like, I know, you told me, but we may need to do that. And so visual reminders can be really helpful. And so connectability.ca is a good place where you can go to make some of those visuals, which is going to be in the resource list. Also, it's important to ask if they need your help. So especially perhaps with our youth who are getting a little bit older, they sometimes can be a little bit, they might not want our support as much. And so sometimes it's asking them, how can I help you? Right. So again, this is part of advocacy, right? Showing them that asking for help is okay. Asking their teachers, their coaches. You want to teach them that it's okay to ask for help in their environment. It's really important that they know that asking for help isn't a bad thing. You know, sometimes I think we all have memory blimps every now and then. So you want to teach them that it's okay to ask for help, and to teach them that, you know, we ask for help every day of our lives on a kind of a daily basis. And so the more you teach that to them, the more willing they're going to be. And so you can ask them, how can I help you remember this? Whether it be a visual, whether it be a call, you know, 15 minutes before an appointment to tell them you got to get ready for something, whatever it may be. And then you're going to repeat, and reteach. So oftentimes we have to pre-teach or kind of prime ahead of time for certain skills, and we have to reteach known skills. So it's not uncommon if you have a kiddo, especially who's having inconsistent performances, that you have to reteach something to them, perhaps on a daily basis until it moves from kind of their short-term to their long-term memory. And you might need to reteach something in different environments. So I actually had a young boy I had worked with. Well, he's a teenager, and he had learned to do laundry, but then when he was in a different environment, his parents had thought he was just going to be able to continue to do his laundry in that different environment. They're like, but he knows how to do laundry. And I said, yes, but the laundry machine is different. Where you place your laundry detergent is different. I said, so yes, he's been taught how to do his laundry, but it's not a generalized skill for him. It's a very specific skill that he's learned in a very specific environment. And now it's different than it looks like at your home. So we're going to have to reteach it to him in a different way. So we used visuals to help him understand what he needed to do. So just because they've got a skill doesn't mean they're going to be able to use it from one environment to the next. So it's really important that we think about hands-on learning, and that's part of working on their strengths. And I think repetition is something I've stressed a lot in this. And the reason is that it kind of, like I had mentioned, it helps move things from their short-term memory, hopefully to their long-term memory, because short-term memory is often impaired with FASD, not for all individuals, but it can be one of the brain domains impacted. So repetition is a way that helps us learn. But repetition strengthens skills in everyone's brains. It helps it, like, even for yourself, myself, and everybody else, right? The more we do something, the more we practice something, the easier it becomes. And so even those with memory or impulsivity difficulties, it's going to help them as well. And the more we do something, the more the less taxing it is on our brain. So I think we can all think of times when, you know, I think of tying my shoes, right? It's a skill that I don't even have to think about doing anymore, because my hands just kind of take over. They just do it for themselves. I don't have to think about it anymore because my hands know what they're doing. So I can oftentimes be having a full-blown conversation and do that without thinking about it. And it just happens because my hands know what they're doing. But when I was first learning to tie my shoes, I couldn't talk to anyone. It was the only thing I could focus on. And so same thing for this. So the more you practice, the more you repeat, the easier it's going to be. And then we don't want to do it forced. So the more we can have it occur naturally in our everyday environment, the easier it's going to be. So for example, like tying your shoes, you don't want to force a child or a youth to sit there for 15 minutes every day and practice it, you know, in a kind of at 10 o'clock, if they're not going anywhere, it doesn't really make sense. So it makes more sense to give more time in the morning, get up a little bit earlier, give ample time for them to work on that before school, right? So you're going to give enough time so that they can practice tying their shoes and have that extra time that if they need the support, you can jump in and help them. And then they'll still be ready on time. So it's kind of happening on a daily basis, but you're giving enough time and it's happening in a natural environment. So you also want to make sure that it's structured and it's built into your routine. So kind of like the tying your shoes, that could be something that's done even within a school setting. I've had some of the kiddos I support where we had them start to get ready for home a little bit earlier because it took them a little bit longer to get ready. So they maybe started to get ready for the bus 5-10 minutes earlier than the rest of their peers at times, because we wanted to give them their independence to kind of work or on some of their tasks, but we knew it was going to take them a little bit more time. So you want to build it into the routine, but you also want to be really consistent. So you want to make sure that it's a consistent routine. So our kiddos thrive on consistency in structure. So it's really important that we do that. And also support the child, right? So, walk them through the skill as many times as needed. Tasks, you can also have them do it like with the caregiver. You can do it less times, you can do it more times. And if you're reteaching something, you want to set enough time every morning to do it, or you want to set enough time for them to do it where it's not going to cause them distress, right? You don't want to be like, okay, well, your bus is going to be here in a minute. If you're doing that, you haven't given enough time, and then it's not going to be in a positive time frame kind of.
So thank you. Like Eric has said, my name's Kim Stewart. I'm the FASD coordinator at NOACH. So I'm going to take over and we're going to talk about lying. No, we're not. We're going to talk about confabulating. So lying is what some people know it as, but it's not the same. It's not an intentional thing. Our kiddos and our peeps affected with FASD have some memory gaps, and this often will contribute to the storytelling and different things like that. And it's not called lying, it's called confabulating. So due to the problems with memory, your child may be confused about what really happened, may retell events in an incorrect order, may feel ashamed for not remembering, so they make it up to cover, may confabulate to fill in pieces they've forgotten or misunderstood. The brain may automatically fill in the blanks with things they've imagined, heard, or even seen on screens to make sense of an event. It happens to us at times, and this is so true. So there was an example given, and it was of, so let's say there was a car accident or something, and they interviewed, 5 different people. Each person's story would be a little bit different because we take into consideration our life events, maybe what our day's been like. There's things we do without even knowing it. And when I think about confabulation, I often think of so I live on an island, and so our cell phone reception is not very good. So often, I'll get a call and I hear, some words, but not everything, it's kind of bits and pieces. So my brain will automatically connect kind of what had happened, right? Okay, my mom has my child drop off 30, so I automatically think that, my mom's going to drop my son off at 3, when really she could have said something different, right? And this is where it comes down to. And what we have to remember is people impacted by FASD may only understand only understand every third word. So if you're absorbing only every third word, and then somebody asks you a question about that, what's it going to look like? Our brain's going to automatically try to fill some of this stuff in. So we really want people to understand confabulation. So how do we accommodate this? You want to reduce the opportunity to confabulate. So we're not going to be asking a lot of questions. We're going to just be concrete and direct. Instead of asking if they did something, ask them to show you. So this is a good accommodation. So your child goes in, he has a snack, You're not going to ask him, you know, what he had. Maybe you want to say, can you show me what you just ate? Something like that. Show me what you picked up in your room. Just ask what you really need to know. Yes. Avoid unnecessary questions. Remember, give them time to process. And this is a big one. You know, when we ask our caregivers, and we ask people, how long did you give them to process? And we automatically think, oh yeah, no, we gave them a couple minutes, we gave them, you know, enough time. But when we actually time ourselves, we're not giving people enough time to absorb. So I know I'm gonna have a conversation with one of my kiddos or somebody on the spectrum. I may say, okay, I'm gonna ask you a question, but I don't want you to answer it right now. I want you to go grab a glass of water, then come back. So I will ask them the question and I'll say that right off. Nope, don't answer it yet. Grab a glass of water, come back and we'll talk. And that way you're giving them that kind of time to process. Because we all think we're giving time when we're really not. I think people don't really like silence, you know, and sometimes we have to just be okay with it. We have to give people that extra processing time. They may give you a response for the question you asked a while back from earlier in the conversation. And that's something we want to be aware, right? FASD is a brain thing. So there's lots going on with our brains as well as kiddos and people impacted. So accommodations for confabulations. Stay connected. Do not punish for confabulation or storytelling. Yeah, this is really important. People aren't doing this purposefully. It's not something that they've decided they're going to tell this big story and they're going to get everybody going. So it's not helpful to consequence confabulation. Your child may have short-term memory problems or challenges, controlling impulsivity or seeing things differently when under stress or not able to catch every word someone said to them. Makes sense, right? Consequencing will not decrease the confabulation. It will only frustrate your child. It's true. Focusing on supporting their challenges with attention, memory, language, and inability to always control their impulses. Yeah, so we really want to work with our kids on impulse control. That's going to help in a lot of different areas as they grow up, including confabulation. And that's why when we say, you know what, I don't want you to answer this right now, you know, I'm going to ask you again, give it some time. That's really kind of a great strategy. Brain domain, social skills, adaptive skills. So this is a big one. Social skills have huge impacts on our kids and as they grow up, right? If we have some social skills impairments, we're going to see some struggles as they get older. So we really want to support that brain domain. Your child may act younger than same age peers. So this is a big thing. And when I'm working with families that are impacted, one of my first strategies will be cut the age in half. You know, if you have a 10-year-old, I want you to give your expectations to be like a 5-year-old. And you know what? It may not be in every area, but if you start there, then you can see your kids succeed, right? So you've got a 10-year-old. If you supervise them like they're 5, your expectations, give them to like they're 5, take that age, cut it right in half and start there. And you'll see your kids, you know, there'll be some areas that you don't need to do that and they can go above and beyond. And then there may be some areas that you may even need to change it up a little bit even more, but really starting by cutting that age in half. May attempt to gain attention inappropriate or invade peers' boundaries. Yes, we see this, right? If we're, you know, if we're a 10-year-old, but we're acting in all different ways, like a 5-year-old, their boundaries and everything is going to be different. So we want to make sure that we're supporting this child. They may be teased or rejected. And this is a hard one. I think this is also really hard as a caregiver and as a parent, you know, to have a child that may be being bullied or rejected. And that's why we really want to make sure that there's ways that we can support that and set up some positive interactions with peers. They may be bullied or told by peers to do things they are not allowed to do. Yes, we see this. Unfortunately, sometimes our kids can be victims. And I think it's this way of they're trying to, you know, make friends so they can easily be, you know, misstrued or told to do something. And because of the impulse issues, they may go do it, right? So we really want to make sure that we're supervising and supporting. They may be vulnerable to predators posing as friends. And this is a big thing. So we're going to talk a little bit about internet safety. and just really supervision. Social skills accommodations. This is a P. Teach by practicing these scenarios with your child. Yes, this is a big thing. So if we know, let's say we know there's a birthday party, your son's been invited to the birthday party. It's awesome when you're able to connect with that mom maybe ahead of time and say, okay, you know, Johnny's invited to this birthday party. He really wants to go. Do you think we could meet you ahead of time? So maybe you're going to go to that, you know, Johnny's house before the party, you know, be able to see where, meet his mom, be able to maybe even pick out a good calm down kind of quiet spot. I call it the chill zone sometimes. And it's a nice kind of way that you can keep rehearsing and practicing these kinds of things with your kids. Like Liane had said, repetition is so important. And when we're talking about social skills, repetition is another great strength and thing that we can do to help our kids. Managing bullies, very important. Walking away, talking to an adult, play in schoolyard near supervisors. So these are the ways we want to manage bullies. We want to teach your kids to walk away, talk to an adult, and play in the schoolyard near supervisors. So what I've done with some of the kids that I've worked with is been able to kind of identify who is a teacher that's accessible during school. Who is the teacher that's going to be the schoolyard monitor? Can my child know that teacher? Can we, you know, maybe do some practicing after? Or is there somebody in the school that's always accessible? Somebody like the receptionist, you know, she's there. So you can kind of practice this with your child that, you know, if you're in class or, you know, or something's happening and you need that kind of safe space and it, you know, you need it to be supervised. Are there different ways that you can kind of, you know, set up these plans ahead of time? Handling rejection or frustration with peers. This can be, you know, a sad kind of difficult thing that we need to do, but being able to practice this and walk it over with your child, you can see lots of different positive things happen. And you know, I love having a great relationship with your schools. So you're able to talk to them and say, you know, is there somebody in, I'm just picking Johnny as a name, in Johnny's class that you could pair up with, you know, or is there somebody who's maybe younger in the school that could use a buddy, and just being able to set up these kinds of positive interactions. And being able to kind of, I like the idea of having that strengths tally, right? Having that strengths list, because when you have a child coming home with these, you know, with the rejection and feeling, you know, frustrated with peers, then it's a good time to kind of review some of your strength skills. Okay, you know what? Johnny's really athletic. So maybe we can start, you know, a running thing after school. You know, any kids that want to come, we can, you know, go for a run. But really being able to kind of link your child to positive interactions. Personal boundaries, this is a big thing. And there's lots of different strategies with this. And you know, I like to teach our kids that closed doors, you know, need to be knocked, and you want to actually show him things like that. So, you know, before you enter a room, make sure you're knocking those doors. You want to talk about bubbles and people's space. But when you're talking to your kiddos with FASD, it has to be concrete, you know? So this idea of personal space is such an abstract kind of idea. So you might want to even do things like have a hula hoop and, you know, show your child this is the person's space, you know, something like that, to be able to act these things out. Turn taking and sharing. This is because this is kind of another abstract thought. So we really want to make sure that we're practicing this. And I've even made it more concrete and had timers. You know what? You get to, you know, play with your Barbies, play with this Barbie until the timer goes off, and then it's your friend Sally's turn to play with the Barbie. Things like that. Strengths, we want to remember hands-on learner, strong visual skills. Yes, a lot of our kids do really well with pictures and with these kind of visuals. Hands-on learning, you want to show them how to do things by physically showing them. Social skills accommodations. Provide pro-social opportunities, absolutely. Social skills groups. Recreational clubs, groups where there's extra supervision, guidance, and built-in accommodation. Yeah, so, you know, I love all these kinds of, COVID's a little different, but all these kind of recreational groups and programs are great for our kids, especially when they're able to have those built-in accommodations. So if I have, let's say, a child who wants to start Beavers, he wants to go to Beavers, and we think that's a great thing for him to go to. So we want to do something ahead of time, like call the leader and say, this is my child, these are his strengths, these are the areas in which he needs to be supported. Then maybe, you know, as an adult, maybe you're going to go to the first class. Maybe you're going to bring him in and show him the area where they're going to be having Beavers. You know, you want to show them where a great calm down kind of section, chill section is. You want to show them where the washroom is. You know, you want to meet the leaders. You want to talk about any expectations that the group may have beforehand, and then you want to keep practicing this. So that's a big thing you want to keep doing, and you want to look at different programs that are in your area that already have some of these kind of supervision or have some of these kind of understanding of skills and abilities. Be present when they are using the internet. This is a big one. And I think now, as we're doing this online learning stuff, it can be hard, right? Like, I'm expected to work all day and my child's on the internet. How can I ensure that that's happening safely? And we can do things, and you want it to be like an automatic thing. So, you know, if Sally is using the internet, that maybe in the evening you're going through and checking to see what they're looking at. It's not necessarily even to consequence or to punish, but just to be able to have that kind of open dialogue after. Oh, I see, you know, you were looking at this. Can we talk more about that? You know, what is a safe person? What does that look like? Can people, you know, look safe that aren't safe, you know, and keep having these conversations. You always want to make sure that your internet is somewhere open and public. You want to be able to, you know, see what your child is viewing and see who your child is talking to. And look at their Facebook, be one of their friends on Facebook, you know, and just be aware too, because our kids can be pretty smart. Sometimes they have, you know, an account for mom and an account for their friends. You really want to make sure that you're keeping an eye on that. Let them know about unsafe people, friends on the internet, and how they don't always have to tell the truth. Yes, so we want to teach things. And for our concrete visual learners, we don't want to say things, well, you shouldn't always, you know, share your phone number. Just say, don't share your phone number. Or, you know, don't do that. Like, your friend should already know where you live. You know, you don't need to, there's things you shouldn't need to tell them. Watch out for online bullying from friends. Yeah, this is a big thing. You want to just be a leader in your child's life. You know, you want, and I know it gets harder as kiddos get older, they want more independence, but really being able to, you know, watch out for online bullying. And what I've you know, worked with a parent that had, well, it was her son's older cousin, and it was kind of neat. He really took that kind of role of, you know, watching out for him, especially on the internet. He was able to call his aunt and say, you know what, Johnny's been talking to this person and this person's not a good person. You know, so just kind of being able to set up these natural networks of support can be really, really helpful. Social skills accommodations. Talk to your child's teacher. Yes, yes, yes. We want school to be a positive experience. School can often act as a respite for our parents. So we want to make sure that it continues to be a positive thing. So I've actually had, like, communication books is a big one, or emails, and to be able to talk to your teachers and understand, make sure that they're aware of FASD and understand that your child may have on days and off days. So we might need to have different expectations for those off days. Find a way to do this that works for both you and your teacher. Absolutely. Communication books, logs, emails. I think this is a big thing, because I love when schools and parents have this kind of clear communication that's a normal part of their day. Yep, you know, Johnny had a great day. Oh, you might want to check Johnny's backpack, or, you know, just the regular kind of communication. But also you might want to be able to have this open dialogue, because your teacher may be able to tell you, you know what, I'm taking a day off on Thursday, so we're going to have a supply teacher And then you as the caregiver and as the parent can decide, you know what, I know that the Johnny really struggles with supply teachers. Maybe today is a good day for Johnny to have a day at home. Or, you know what, maybe Johnny can go to school for half the day and then can come home. Whatever you decide is the strategy that works best for your school and yourself, that is what you want to kind of work on. Bring your FASD worker and other support person. This is a big thing. We offer education sessions for teachers and school staff, and we notice that there's a lot of teachers that are just learning about FASD, and it's so important because sometimes FASD can look like just the behaviors, right? The behaviors are the symptom of the disability. So we really want to not have your child labeled as a behavior child, you know, so we want to be able to have this communication with the schools. And FASD workers, such as myself, do this all the time, right? And it's really important to have these meetings and educate our teachers and our support staff about FASD and the strategies. They can help with expertise, strategies, and personal support. Maintain this communication often and on a regular basis. Yep. Yeah, you don't want to always just be talking to your teachers and your faculty when there's issues. You want to have it be part of the normal everyday kind of occurrence. Yep. And it can be simply, you know, there's lots of different ways to do it. You can just have kind of, you know, a check mark system, or, you know, just a little quick note. It doesn't have to be this big, long interview every day kind of thing. Social skills accommodations. Talk to your child. Yes, that's a big one. Get to know your kids, take interest in what they like to do. Develop a safety plan with your child for what they can do when they are feeling overwhelmed by peers, sound, lights, movement in the environment. So yeah, so when I was fostering kids with FASD, this became part of our normal routine. You know, if we were going to the movie theater, I would show them where they can go if they're feeling overwhelmed. You know, if we're going to the park and they want to go and play in the equipment, and that's fine, I can supervise them from the bench. They wanted to kind of do their own thing. Where can they go if they're getting overwhelmed? They come see me. This is where they'll sit. Even if they're having kind of like a play date with somebody. Okay, this is the mom that's here. She's going to be supervising it. If you're having these feelings, you can talk to her. Just different kind of things you want. And really important, as much as possible, to have your child be part of the plan. We really want to always be teaching our kids how to advocate and teaching them about their needs and how to kind of advocate and be able to get the help and support they need. Keep your plans simple. Yes, the simpler, the better. And it's really nice when you can have the same plan that moves where you are, you know, so if you're at the playground, it's the same kind of plan. If you go to the movie theater, it's the same kind of plan. If you go to the grocery store, keeping things simple is key. Practice the plan. You want to practice this plan, repetition. You want to practice this plan over and over again. And then you want to practice it when your child's having an on day, but you also want to try to practice it when your child's having an off day as well. Social skills accommodations. Think about how old your child acts around kids their age. So that's that, cutting the age in half. Consider this developmental age rather than their real age when organizing and planning peer-related activities such as birthday parties, play dates, and family functions. Absolutely. So you want your child to have as much social success as possible. So if your child in every which way, you know, feels like a 5-year-old, then have peers that are 5 years old, you know, have activities for that 5-year-old. We want them to have success, and this is kind of how we're going to get it. Play dates with just one other child is often better. Yeah, 3's a crowd, right? Especially when we're starting off, you know, gaining some of these social skills and learning. Keep the play dates short and just with one child. And it's nice if you can have them kind of fluid too. If you talk to the other parent and say, okay, you know, why don't you have Sally come over for a couple hours and then we can touch base. So we know, you know what, if your child's become drained or they're clearly just too much stimuli, then we can, you know, end the play date a little bit sooner. And then pick another day, right? Okay, that worked out great. You know, we knew that Sally or Johnny did really well with 2 hours. Okay, that's awesome. So next time let's set up, you know, the play date for 2 hours. just being able to see where your child's at and going from there. Supervised social activities. This is so important. You always want to supervise by that half age, right? You want to supervise at where they're at rather than their chronological age. And it helps keep everyone safe. And adults can also provide structure activity for kids to do together. Absolutely. Our kiddos with FASD do great with structure. So let's make sure that their activities are set up for success. Sexuality. This is a big one. And there's been a few different workshops out there actually for FASD and sexuality that I really encourage people to check out. And if there's one coming to your area, because our kiddos can be victimized and can struggle with understanding boundaries, we always want to be having open dialogue. We want to teach them. And it's important to teach them the actual proper words for their body parts. Penises are penises, vaginas are vaginas. We want to give them the lingo right off the hop. And we really, for our kids with FASD, nothing is taboo, right? We want to be having these conversations often so that when those tough kind of things happen, that our kids feel comfortable talking to us about it. Have as many conversations as needed, absolutely. And this is another reason that we want to be kind of aware and checking to see what they're looking at on the internet, is because it can open dialogue too. Oh, I noticed that you visited this site. Do you have any questions about it? What do you think about, just having these kind of open dialogue? Let them know they can ask you anything, anytime. Absolutely. Kids have questions, right? And if they're not asking you, who are they asking? Is what you want to know. So there's some great websites out there, teachingsexualityhealth.ca. Be proactive, be prepared. And amaze.org, more info, less weird.
Thank you, Kim. That was great. So there was a question out there about the autonomic nervous system. I don't know if I'm saying that right, but so the question was, is the autonomic system implicated or affected by FASD? That was a question that was in the chat. And no, it should not be affected at all. So what the autonomic system does is it helps regulate what we consider automatic bodily functions, right? Like secretions, our respiratory, but also our sexual drive and the fight, flight, freeze response, which we'll go over. Those sexual drive, fight, flight, freeze, that's found in the limbic system. So that's kind of like in the middle of your brain. And then here at the bottom is the basic system. What we find with FASD, it's the higher cortical functioning that's affected, right? So those 10 brain domains that we discussed, and those are not found in the autonomic system. So it's more abstract thought, language, those things that you need to think about in the moment. It's not those things that happen automatically or like reflexes like fight, flight, freeze, sexual arousal, and then more basic systems like breathing. So I hope that answers your question. That does not mean that a kid with FASD doesn't have those things affected, but those things being affected, it would not be explained by FASD. It could be something else that's happening with that child or that individual. Does that answer that question? Okay, so let's go to the next brain function. It's the last one we'll talk about today, and that is the, next brain domain, that's affect regulation. So affect regulation is the skill of managing and controlling your emotions, thoughts, and behaviors in a way that best helps you navigate the world around you. We all struggle with this. We all get caught up in a wave of emotions and thoughts that lead us to behaviors that don't help us. But we get better at regulating those things as we get older. Our bodies naturally produce bursts of energy to better respond to danger, or what we perceive as danger. And that's what we call the fight, flight, freeze response. So a lot of you already know what that is. Fight, flight, freeze is your body's natural reaction to danger, right? That is not affected in FASD. It still happens. It helps all of us react to perceived threats. So on the news, you might hear someone say, he came at me and I don't know, I just pushed him to the ground. That's fight. Or I didn't have to think, I just jumped out of the way. That's flight. Or I froze and then I knew exactly what to do. That's freeze. Fight, flight, freeze is automatic. You cannot control it. None of us can. It's a reflex. Happens automatically. It's just that some of us over time, as we've gotten older, have become better at judging what really is danger and what is not. Someone with FASD may misconstrue events as serious threats. Remember Amy, when her brother got a compliment and she got upset, what may have been happening is she may have misconstrued that event as a serious threat to her safety. So when your child is upset, fight, flight, freeze is likely occurring. Your child is not being oppositional or disrespecting you on purpose. What may be happening is they may be feeling under attack. So they're not disrespecting you. They may feel that their safety is threatened and they're using everything in their arsenal like swearing, hitting, pushing, without being able to temper their reaction appropriately. So they look out of control to us. And with flight, freeze, and FASD, what we see in FASD is that reaction may be much more intense. So our kids, our teens need our help to feel safe again because they're not feeling safe when they react that way. So threats of punishment when they're already feeling threatened in the first place will only increase fight, flight, freeze. And what happens in fight, flight, freeze, even though it's there, it's an automatic reaction to help us, to help us survive in the world, what happens is the brain it feels like the brain is short circuiting, right? So decision-making in the moment can become worse. And it can be very difficult to process new information. It's kind of like when your computer, you're pressing all the buttons on your computer and you're asking to do a million things at once, your computer will freeze because all the resources have been used up. Fight, flight, freeze can have that same effect on the body. It can feel like it's using up all your resources. And with fetal alcohol spectrum disorder, we know that fight, flight, freeze is much harder to manage because we know that our kiddos, our teens, they may view events as serious threats to their safety. Events that we wouldn't find dangerous, they may feel are dangerous. And this physiological reflex may be much more intense with FASD. And we know that some individuals with FASD may have more reactivity to start with. So what does that mean to have more reactivity to start with? So remember, when we talk about regulation, sometimes we're also talking about emotional regulation, but we're really referring to how well and how efficiently and effectively a person can deal with something that's stressful and then recover. So here, blue represents the level of innate physiological arousal and reactivity. Yellow is the environmental stress in everyday life. So person A has the typical level of physiological arousal and reactivity. This is what's already happening in the brain before they get a stressor. This is what's happening in the body, right? So a stressor, yellow, is added to their life, but they can manage it. The cup doesn't overflow. Person B has FASD. Their level of physiological arousal may be much higher at baseline. So they have more blue before we add stress. There's a lot more going on in the brain of some with FASD than others. And that's because they're working much harder than everyone else just to keep up, right? So your kid might be in a class where the kid next to them is getting better grades than your own kiddo, but chances are your kiddo is working much harder than everyone else in that classroom, including that straight A student, because they're working just to keep up. So there's a lot going on in their brain to start off with. So they may have a higher level of reactivity before we add a stressor, right? So then you add the same amount of stress as person A, the same amount of yellow, and their cup might overflow and they might lose control. So the issue is that the person with FASD may have more reactivity to start with than others, and therefore may react more to stressors. Your child is not getting upset on purpose. It's best to just accept your child's emotions. Everyone has a right to be upset. Everyone has a right to their emotions and expressing their emotions in an appropriate manner. Being mad at your child or youth, or having the gall, for them, or being mad at them for having the gall to be upset in the first place, will send them deeper into fight, flight, freeze. It's better to just accept their emotions. They have a right to that emotion. Remain calm, and you can talk about what happened later, right? Here we're involving them in the strategy and the accommodation. When they're upset, don't ask why. The answer will probably be, I don't know. And that's probably true. And just because they can get under control yesterday doesn't mean they can get under control today. When they're upset, the best thing to do is to show them that they are safe. They feel unsafe right now. Tell them, show them. And keep talking to a minimum. Remember, information, all that stuff coming at them, right? Even in normal circumstances, they may have a hard time filtering through all this sensory input. But when they're very upset and their brain's being overtaken by fight, flight, freeze, talking is just more noise for them to process, for their brain to work on. When they're upset like this, it's better to use a calm and neutral tone, what we call co-regulation, right? So children often rely on the person in the room that they say is an authority figure to know how to feel in certain situations. Sometimes you might watch a comedy film with your child and there's a joke on screen and they might look back at you to see if you're laughing, right? They want to know how you're feeling, if you thought it was funny. Well, the same can be true when your child is upset. When they're in a situation where they're in fight, flight, freeze, they might notice how you're reacting, right? So if you're reacting in a calm manner in that situation that they're upset in, that's adding that extra level of support, right? It's an extra layer of a prompt to let them know that the environment we now find ourselves in is safe because the authority figure isn't freaking out, isn't upset, they're calm, right? So it's just that extra layer letting them know that the environment we're in is safe. It may not make them calm down more, but it won't make them escalate more if the person with them is showing them that where we are right now is safe. And we do that by remaining calm. So you want to mirror the emotion that you want to receive back. And if you tell your child that they're being manipulative when they're in this state, they're not going to trust us when we try and show them, when we try and tell them that they're safe. So remember, threats just send them more into fight, flight, freeze. And things can worsen, right? So when you're in fight, flight, freeze, you can even misunderstand a threat and it can seem much worse than it actually is. So no threats. Here we're going to advocate. We're going to develop a plan with co-caregivers, so other individuals who help take care of your child. Could be a teacher, it could be your sister who takes her kid in on weekday afternoons. And we work on a plan where we identify those situations that cause our child to feel this way, that cause our child to be upset, what we might call triggers. Knowing that might help us to avoid some of these situations, but it also lets us know how to prepare when they're in this state, right? So it'll change how we react because we want to react in a calm manner. Being prepared will also give you confidence, right? You're more likely to remain calm if you're confident. And keep this plan updated with everyone that you've come up with the plan with, right? Everyone that's helping co-parent your child, even teachers, should be involved in this plan and in any kind of update or the latest information that's available. And involve your child in this plan if possible. You can develop a plan with your, a plan just between you and your child as well during calm times of what to do when they're upset, right? So it could be that when you're planning with your child, you can come up with a cue to let them know, when they're feeling this way, that mom or dad will give you sort of a visual sign, and that'll be a cue to start the plan that we've come up with. And it could be the plan could just be going into another room. It could be doing activities that the child knows calms them down, right? Could maybe putting on noise canceling headphones or wrapping themselves up in a tight blanket in their favorite corner of the house. And then, that visual cue that you come up with could be a picture of the different activities that are available to calm down, or it could be maybe a hand gesture. You want to practice that visual cue so your kid knows what it looks like. And a visual cue will be much more effective than giving them words when they're upset, right? A lot of our kids are visual learners in the first place, so visuals mean a lot more to them than words. And when they're in this state, we need to give them things that are very meaningful to them, that are easy to understand. Another thing we have to watch out for is excitement, right? Being excited is another thing that can cause someone to get that burst of energy, which can take over brain functioning, right? You know, when you can't fall asleep the night before because something exciting is about to happen the next day, it's that kind of a feeling. For a kiddo, feeling like this can feel a lot like anxiety. It can look like anxiety to them. And they might be on edge when they're this excited, and they might be more easily upset, or things can make them more easily upset when they're in this state of excitement. So, you know, if you know this is the kind of thing that upsets your kid, or is more likely to upset them, being excited, when they are excited, it's best that you remain calm, right? You're co-regulating in those times. So if they're jumping up and down because we're going to the amusement park in 10 minutes, it's best if you don't jump up and down with them, even though you might feel like it because you want to enjoy the celebration. But if you know your child is easily upset when they're excited, you want to co-regulate. You want to mirror the emotion that you want to receive back, so you remain calm. You'll start to recognize or already know the signs of when your child is about to be upset. So some of these might help you when they're on the verge. Things like reducing expectations, right? If you know they're about to become upset, make things easier for them in that instant. So it might feel like we're giving in, but what we're doing is we're meeting the child where they're at right now. And we're also exposing them in those moments to multiple experiences where situations de-escalated before things got worse. Someone who's never experienced de-escalation, so that's calming down before things get worse, doesn't really know what it feels like, so therefore doesn't know what it really is. So we want to support them when they de-escalate as much as possible. So we're giving them, sort of that hands-on learner, we're giving them lots of experiences where they de-escalate. And then they might be able to do that on their own, right? Over multiple times. Again, when they're on the verge, don't give their brain work to do, like ask them to do breathing exercises. If breathing exercises is something they haven't mastered yet, or something they're just learning, it's best to just redirect. Maybe, again, to another room, to another easier activity. Again, you could use that visual cue. You know, I know T told us about using a picture with different activities that we know calms the child down. And this could be worked out with the child or teen beforehand, right? When they're not upset. And they can, when they're about to become upset, you can sort of give them the picture, show it to them, and they could point to the activity that they want to do, like maybe putting on noise canceling headphones, and you could help provide that for them, or you may have worked it out where they provide it for themselves, right? That could be something you've worked out ahead of time in your plan. This is a slide I snuck in. It's a great quote. It's from Nathan Ori, and he says, testing is often certainty-seeking behavior. And we see that, right? We see, I was that kind of kid too, testing with new people in the environment. So a new teacher in a familiar environment, which is the classroom. The new teacher is now this new uncertain thing that's just been added. So we often see behaviors from certain kids when these unexpected things happen with that new caregiver, with that new teacher. And we think, oh, they're just trying to see what they can get away with this new person. But what they might actually be doing is they're not really seeing what they can get away with. They're testing to see if things will stay consistent within that environment. It's their body, right? They want to know that safety and consistency are still available in this environment. So they're testing this new authority figure, this new person that's come in that they know, that they feel is going to have a huge effect on this consistent environment that they know. Often what happens when kids do this testing behavior, we feel they're trying to see what they can get away with. So right away, we start taking things away just to let them know you can't get away with this. But what we end up doing is we end up taking away those consistent things that made them feel safe, those things that they were testing for in the first place. So as teachers, sometimes we might take away a fun scheduled event, something that was already structured in the consistent schedule. So we might take away something like recess to punish or control the behavior. At home, we could do this. We might do the same thing. We might take away something that was scheduled, something like a visit to grandma that was happening. And we've been planning it for it as a family for a while, and now we're canceling it because there's been this testing behavior, right? To try and sort of control this child. But what we're doing is we're taking away consistency, we're taking away structure, and we're increasing the child's anxiety when we do that. We have to show them that no matter what they do, it has no effect on scheduled events. We have to show that consistency and certainty in your environment are not flimsy. Being consistent will decrease anxiety, even if there's initial testing behavior. Okay. I'm very mindful of the time, so I'm just going to jump right into interdependence. It's a section that we added that we thought was very important. We all rely on each other. We all support each other. You know, this whole slideshow that we're doing today, so many people were involved in it, right, to bring this to you. And so even us at work, no one can do it all on their own, especially life, especially as we get to become adults and we have all these responsibilities. It's important to let our kids, our teens, as they grow older with FASD, that they will also need support. And as individuals with FASD do get older, they do need support around things like money management. There's a lot of abstract thought, a lot of abstract concepts in money management, which is something that individuals with FASD require support around, right? Anything to do with stuff that's not right in front of you, like money, like time, they will likely need some kind of support over a long period of time. And of course, that support as they get older might change. It might look differently during different life stages, but they'll likely need lifelong support around things like managing job responsibilities, right? There's a lot of time and executive function skills that are required to manage and maintain a job, housing, life transitions. So think about starting a circle of support for your child, for your teen. And a circle of support, what that is, it's a group of people to support the person during different life stages, during different decisions about during their life. And we want this in place early to provide the caregiver with support, and also in case something happens to caregivers. So it's an extra level of support, and it could be very meaningful, very helpful for our teens, for our young adults. Members, of course, should know your child or youth, and they should care about them. You can invite friends, family, professionals into the group. It's important to involve people who can also help make things happen. And, you know, like any other group, some members change over time. We want to make sure the numbers don't dwindle. There's always a healthy amount of people in that circle of support. It's, you know, it's something that we want to maintain, we want to keep healthy. So add people for upcoming changes, add people for, you know, issues you see are coming down the road. And your child and youth should be able to meet with their circle as friends who can help sort things that may be worrying you. And this should be a positive experience. It's not like that TV show Intervention where, you know, we just tell the person as a group everything they need to do, everything that they're doing wrong. No. This is a positive experience. We want to motivate them to maintain their participation in this circle of support. So always focus on the child or teen's strengths. Remember, what we're doing here is we're building self-image. Confidence level will be reflected in your child's effort level. Before we go into the group, I'm just going to describe the activity. We're going to go back to Amy. You're going to go back into those smaller groups you were in. And this time, when you're seeing Amy's slide and her issues and some of the challenges that the family's experiencing, we want you to think about the strengths that she has. Could some of these strengths help her with some of the challenges that she's going through? And also, are there any accommodations that you have at home that you think might help Amy, or accommodations that you heard today that you think might help improve or prevent some of these challenges? So, we talked a lot today about different ways you can help support your child. And, there's more accommodations found in the resource list that will give you access to through a link in the next few slides. When you're choosing a challenge to work on at home, it's important to prioritize as well appropriately. So first, work on things that might cause a danger to the individual or others, like aggression. And then second, work on things that are very frequent, like maybe a morning routine or a bedtime routine. And then other challenges can be addressed later. So this is our resource list. This is the link to the resource list. Maybe you could take a screen capture, take a picture with your phone. This resource list is very comprehensive. It's got lots of different information. There's tip sheets for raising a child with FASD, helping or supporting a teen with FASD. There's also information on funded programs. There's information on funding options. There's also links to FASD education. So there's lots of FASD related supports that are listed in this resource list. So I really encourage you to download this resource. It's a PDF file, so you can actually keep it on your device and have a copy with you that travels with you. There's also an e-learning module which will be available in the next few weeks. It'll complement the workshop today. It's a 20-minute e-course and it provides caregivers with tools to build on their strengths and broaden their knowledge of FASD. It's very parent focused and it was created by parents who are raising children with FASD. It's called Living Life on the Flip Side, a Caregiver's Perspective. And if you haven't done so already, please connect with the FASD worker in your area. Their contact information can be found using the FASD Ontario portal, the online portal, where you can type in your postal code and it'll list all the FASD resources that are close to you geographically. Here's the link. If you could take a screenshot of that, but if you Google FASD Ontario or Health Nexus, who are the people who house this database, you'll be able to find it online. Again, your child or youth only needs to be suspected of FASD. They don't need the official diagnosis to receive this service. And there's also FASD family and caregiver support groups all across the province. Find the closest one to you by using, again, the FASD Ontario online portal. These groups provide an opportunity for mentorship, information sharing, emotional support, and awareness activities. We want to acknowledge that fetal alcohol spectrum disorder is not an Indigenous issue. It affects all walks of life, all cultures, and all communities. But we also want to highlight a resource today that some of our contributors put together. I believe Chrysta was one of the contributors. But I know a lot of our partners at Firefly contribute to this amazing guide. It's called Parenting Indigenous Children with FASD, a guide to culture for non-Indigenous caregivers. You want to provide the best parenting for the Indigenous child with FASD you care for. You may wonder about the importance of the child's Indigenous culture and heritage, whether it be Inuit, First Nations, or Métis. Connecting to culture is a source of strength and healing. It supports a sense of self-identity and belonging. It creates well-being, builds self-esteem, and helps children to feel they have a place in the world. It is the right of all children to feel connected to their culture. Ideas to respectfully connect the child to their culture can be found in the resource. And again, it's called Parenting Indigenous Children with FASD, a Guide to Culture for Non-Indigenous Caregivers. This resource can be found in the resource list that we talked about earlier. A French version of this guide will soon be available, I believe in the next month. So keep an eye out for that if you're looking for the resource in French. You can also contact me via email. I'll put my email address in the chat shortly, and I can let you know when that resource becomes available in French. So thank you. We have a parent called Marianne Bukowski who helped contribute to our presentation today. There was another parent as well who was just as great and wonderful, Darlene Duran. Marianne said, "We know that parenting children with FASD can be rewarding and our loved ones can live successful, productive lives with support." We are part of a consortium, again, of 28 agencies serving 34 regions. So today, we brought you this presentation. We're the Coordinated Service Planning Provincial Network, and these are our 28 partners. And again, thank you to all the contributors who helped in the development of the material for this session. Chrysta, who was part of the chat today, was a big part of that. Also, thank you to our web producer, Mariana Perez. I hope I'm saying that right. She is a big part of bringing all the tech for us to provide this to you today. And also, our silent big partner who does all the heavy lifting, Ayana Dimitris. She is the project coordinator who did all the work to bring this, all the details to bring this to you today. And also thank you to our sponsor, the Ontario Ministry of Children, Community and Social Services, whose funding made this workshop possible. Your feedback is important to us. We do want to hear from you about your experience in today's presentation. So very soon you'll receive a brief survey to the email you used to register for today's event. We'd really love for you to fill it out. Thank you again for joining us, and on behalf of everyone at the Coordinated Service Planning Provincial Network, we wish you a great day. Thank you.